It's a great session, and our speakers will have a lot to say that I think you'll enjoy. The Alliance for Health Policy gratefully acknowledges the Catholic Health Association for supporting today's webinar.
Good morning, everyone, and welcome to the Health Policy Academy. My name is Lisa Smith, and I'm the Vice President for Advocacy and Public Policy with the Catholic Health Association of the United States. And I want to take just a moment or two to tell you a little bit about CHA and about the Academy. CHA is the national leadership organization of more than 2,200 Catholic hospitals, long-term care facilities, clinics, and service providers that provide care across the country, many of whom are part of Catholic health systems and provide care in all 50 states. Catholic Healthcare is the nation's largest not-for-profit provider of healthcare in the country, and about 1 in every 7 patients every day are admitted to a Catholic hospital. CHA has been working with the Alliance now for over 20 years to provide an annual opportunity for bipartisan discussions on health policy. And it is even more important this year, given the pandemic that we are currently wrestling with. One of the reasons we annually host this event is our mission and commitment to ensuring that everyone in our country has access to quality, affordable health care, especially low-income and vulnerable individuals across the country. The Health Policy Academy has been and continues to be an opportunity to review the basics of our healthcare system and to also hear from key experts across the country in the field of health policy. These discussions have been a great benefit to congressional staff over the past years, and we're hopeful that they are this year as well. I want to thank you for joining us, and I want to thank the team at the Alliance for all of their hard work in pulling together a series of a great 4 sessions. And we want to welcome you and get started. So let me turn it back over. Thanks again for joining us.
Great. Now I'd like to go over to some quick housekeeping items, and then I'll introduce our moderator. Today's discussion is off the record, but we encourage you to take notes. We also want you to be active participants, so please get your questions ready. You should see a dashboard on the right side of your web browser that has a speech bubble icon with a question mark. You can use that icon to submit questions you have for the panelists at any time. We'll collect these questions and address them during the broadcast. You can also chat any technical issues you may be experiencing, and someone will attempt to help. Please be sure to check out our website, allhealthpolicy.org, where you can find background materials, including a resource list and an expert list. Today's slide deck will also be made available on our website soon. Now, I'm so pleased to introduce Nick Ulecki to open with keynote remarks and moderate today's discussion. Nick is a principal at Todd Strategy Group. Prior to joining TSG, Nick was senior advisor to the Secretary of Health and Human Services, where he worked on Medicare, Medicaid, and commercial insurance issues, healthcare reform, and other priorities of the Centers for Medicare Medicaid Services and the Health Resources and Services Administration. Prior to his time at HHS, Nick was a staffer for the House Ways and Means Committee. With this impressive background, we could think of no one better to open today's event and lead this discussion. Nick, I'm very pleased to be leaving this discussion in your expert hands, and thank you so much for joining us.
Thanks, Kate, and thank you for the very kind introduction. I appreciate everybody joining us on a beautiful Friday afternoon for this discussion. I'm really excited to continue the Academy's series here on the importance of healthcare discussions, healthcare policy and process, And honestly, it's exciting always to participate in the activities of the Alliance, only because it was part of my growth as a healthcare staffer in Washington, D.C. I think that my colleagues that are on the panel will agree with me later on, and everyone kind of in healthcare, you know, and it's unfortunate now that some of the younger of you haven't had the experience of a G50 and Dirksen large Alliance panel experience, but hopefully we'll be back there someday soon. But you know, the experiences of learning from both sides of the aisle on great panels all the way through for the last 10 years has truly shaped the way that I think about healthcare, and the way that folks should really understand that to every argument there are both sides, and there's a reason for why both sides have the stance that they do. My hope as part of this series and the discussion is to continue to build on a dialogue-based healthcare policy process that truly is a bipartisan one. I know that it seems hard to fathom nowadays if you spend too much time watching cable television news, but you know, some of my closest friends now, after 10 years in the government and finally entering into the private sector, are both Democrats and Republicans that we work together on healthcare policies ranging from ACOs to health savings accounts, all the way through to later on in life when it was about COVID and other things that when I was at the department. And today's panelists are no different. It really is about knowing where people are, and I'll let the panelists dive deeper into the Hill process. But I wanted to just start with a little bit of a discussion on the differences in the experience between being on the Hill, where I was at the Ways and Means Committee for 8 years, and then the last 2 years at the department. It's totally different. You know, when you're on the Hill, you experience the department as, hey, why aren't they responding to me? You know, and I have to admit, I was probably the most annoying Hill staffer for many years. And when I went in, I spent a good few weeks on an apology tour, as I understood that on the inside, it's sort of like the cruise ship mentality. When you see a cruise ship offshore, it looks like it's moving very, very slowly, and it gets irritating when you're trying to get work done. But when you're on the ship itself, the incredible torrent of meetings, and there are meetings on everything and multiple, and it moves at an incredible speed. So, you know, it was really great to see both sides of that, and to experience it and understand of how the sausage is made and then packaged, and then for technical assistance if you want to get wonky about it. It really made it an interesting last 10 years. I know that, again, the current environment seems like it won't really allow us to get to a bipartisan conversation on healthcare, and I don't mean to get idealistic here, but I have to say it really does begin with you. It really does. You might find that, you know, it's difficult to open a conversation with someone across the aisle as we have these partisan divides, but you know, I truly encourage everybody to get out there and, you know, go have coffee, go have happy hour with someone across the aisle. You'll find that the differences in your actual opinions, as opposed to what you see in the news, are starkly not as divided as you know. There is a ton of work to do, and before we move to the panel, I just want to go over kind of those important things as I've seen it now from both the administration side as well as the congressional side on what work needs to be done and why it's so important, as you'll hear from the panelists today, to work together to try to find ways forward. You know, whether it's what we're going to discover soon from the actuaries on the status of the Medicare trust funds and what will need to be done to have real conversations about, you know, the fact that we're probably at a really high spend last year due to COVID, and what do we do about it? And are we going to be able to look at shaving down providers, or what are the options on program integrity to be able to keep the trust fund sustainable? You know, vulnerable populations and health equity have become the headline news, particularly out of COVID. It's a conversation that's been happening for decades, but you know, really, if there is a silver lining, and I'm reticent to do so when it comes to a tragedy like COVID-19, but if there is one, it's that everyone is now paying attention. The stark divide in health equity and health disparity has become readily apparent, as well as the fact on the other side of the coin, how much technology and healthcare can be paired together to successfully, you know, continue to bridge that gap. And it's going to come with everybody having that conversation and continue to do so. Is it telehealth and some of the great waivers that have happened over the last 2 years? And what can we do? Because once the public health emergency goes away, a lot of the telehealth waivers go away. And so what, as a Congress, what are folks doing to make sure that not only are we going to find a way to make sure that the changes that were made to make healthcare more accessible and convenient continue to exist for our vulnerable populations, our seniors, and low-income populations, but how do we understand that in the context of broadband and expanding the ability to access through visual or audio and making it easy for the physicians and gathering that data to oppose some of the actuarial analysis that says that telehealth is purely additive, which, as you can see from policies like telestroke and others that we were able to get done in the last few years, it really is helpful to the program. And then we get to COVID, to the other COVID policies. There's continuous money that's going to continue flowing out the door for COVID-19. How do we ensure that providers are using those dollars correctly? And how are we going to make sure that, as we saw from the stimulus bill in 2009, 2010, that providers aren't facing, an uphill battle in being able to use the dollars to keep themselves open so that folks have access to healthcare at a time where there's going to be audits and there's going to be OIG, DOJ conversations about, misuse of funds. And so, that kind of just ties me back into the importance of working together with the administration. And it really comes down, regardless of party. You'll find that the panelists that are on the call, as well as many colleagues of mine over the years, have experienced both an administration that was on their side of the aisle and an administration that was not on their side of the aisle. And I think I'll readily admit, it does get a little bit easier when folks are on your side of the aisle because, well, you have barbecues with those folks on a more regular basis than on the other side. But I'll say this, I've never had a problem having the conversation with the incredible federal employees at HHS when it was the Obama administration, the Bush administration, and then obviously in the latest administration while I was outside and on the inside. So, with that, I want to turn it over and begin to start the panel to have a discussion over kind of what that congressional process looks like, what the experience is, and really talk to how, we folks that have been around for a little bit would love to hear, questions from you on how we can help navigate what is a very different environment in healthcare for you than it was for us, and really want to encourage, everybody on this call and everybody who sees this feed to really use the Alliance as a resource. I know that myself and the panelists all did. I know that many of my colleagues over the years did. I know you have CRS. I know you have other resources, but the Alliance really allows you to connect the bridge between Congress, stakeholders, and other governmental entities that will give you the insight that you need to navigate your personal healthcare goals when it comes to legislation. So with that, I am so pleased to be grouped by an esteemed group of experts. First, we have James Palaskevich, who we fondly call JP, Senior Policy Advisor at Alston & Bird, where he advises clients on legislative and public policy matters before Congress, the administration, and other government agencies. Prior to his role at Alston & Bird, JP was Chief Counsel on the House Energy and Commerce Committee, Health Subcommittee, where he oversaw all policy matters under the committee's jurisdiction, including legislation affecting the FDA, Medicare, Medicaid, private insurance, health technology, and public health. Next, I am pleased to introduce Joy McGlone, Senior Director of Government Affairs at CVS Health. Joy is an advocate, a strategist, and a policy advisor with deep knowledge of executive branch agency operations, the legislative process, and corporate strategies. Prior to her role at CVS, Joy held a number of health policy positions in the private sector and was Deputy Staff Director for the Senate Special Committee on Aging. Finally, I'm pleased to introduce Sarah Levin, a former colleague of mine on the Ways and Means Committee, Deputy Director of Medicare and Drug Policy for the House Ways and Means Committee under Chairman Richard Neal. Prior to joining the committee, Sarah worked for the Centers for Medicare and Medicaid Services, the Senate Special Committee on Aging, and a member of Congress from New Hampshire. Thank you all for joining us today. And we're going to start today by hearing from JP. JP, I'll turn it over to you.
Thanks, Nick, and thanks for that introduction. And I'm just grateful to be here today. And as Nick noted, it's hard to think of my career and not think of the Alliance, and certainly has always been part of a relationship I've had since the very start of my career. So I'm going to go through a bunch of concepts really quickly, but I thought the best way to start this discussion on, what does it mean to work in Congress, and how does Congress and the administration work together? Well, I wanted to lay some foundations. First of all, everything we were always told from Schoolhouse Rock is wrong. I look back on that and I think of, learning that every idea gets its day, in a committee and it gets heard out. And that's what we were taught as kids. And, most bills never see the light of day. People always complain that Congress isn't efficient. Well, there were over 12,000 bills introduced in the House and Senate last Congress alone. Sometimes I joke, imagine if we were efficient, and could produce over 10,000 new laws to affect everyone's life, for good or bad. We always were taught that every idea gets worked out between the House and the Senate in a conference committee. I spent 20 years on Capitol Hill, and I was part of 2 formal conference committees in 20 years. So it's not how it works and how we've been told, but that doesn't mean it's not important. And it's because we come a long way. 10 years after the signing of the Constitution, arguably the only service the federal government really controlled that had an impact on every American's life was delivering the mail. We didn't even have a unified currency until the Coinage Act a couple of years later. Today, from the fibers that exist in my jacket to the spectrum of our cell phones, the government has a role in regulating, and Congress has a role in legislating. And so it's important for us to have this discussion. Next slide, please. Here's a quote that I really like from Richard Neustadt, who is a famous presidential historian. I'm not going to read it to you, but again, as we were taught growing up that we have 3 separate branches with their own powers, Neustadt challenges that concept and says that, in fact, we don't have 3 separate branches with 3 separate set of powers. We have 3 branches sharing power. And when you think about it, it's really true. Not to make this discussion about the veto, putting that to aside, there's very few powers any one branch can exercise without the role of another branch having some role to play in it. And I think that's important. Although I go a bit further than Neustadt, and I would say it's not 3 branches sharing power, it's 3 branches competing for power. And in the competition for power, I think it is interesting to kind of find out how that works, because it's not just a competition between the political parties or executive versus legislative. It can be even a competition within Congress between House and Senate. So we have to evaluate each action through this lens of where is the competition for power. Next slide, please. So when we talk about how Congress works, Congress's job is to write laws. That's the purpose, right? Well, I kind of always advise people to take a step back and look at every action of Congress through the lens of the competition for power. And each action needs to be evaluated by a couple of things. And sometimes it's necessary to take off our partisan glasses and view it objectively. First, the idea of success versus influence. We as a country love counting success. Think about it. We're a point counting country, points on the board, who scored more. And so success is often very much the focus of everything that we're taught. Did the president ask for something? Did he get it? Did Congress say that they were going to move on an issue? Did they move on it? Easy binary evaluation. But really, we must also look at the idea of influence, which is much harder to capture because it's done behind the scenes. And so it's not just so much does the president say he wants an infrastructure bill, it's what does he want included? And does Congress go along with it? If at the end of the day, the president says he wants an infrastructure bill and Congress produces a bill they call an infrastructure bill, but it has none of the policies or very few of the policies championed by the administration, is it a success? Certainly by the binary evaluation that typically we do here in town, it is. But it does always behoove us to go a layer deeper and ask how the branches are influencing each other. Members of Congress willing to give the president what he wants, but they may have their own partisan interests. They might have their own constituent interests, their own district interests. How do them influencing the White House to get the larger point on the board influence the package moving forward? How does their support, if they get what they want, mean ultimate success not only for them, but for the president in this competition between the branches? Second, I always ask people to evaluate, if you really want to understand how Congress works, sometimes Congress is trying to pass a law, but sometimes Congress is trying to make a point, and that's the point. And sometimes we would all like to look, again, through our partisan glasses and say, you know, these are good policies, and of course they should become law. But there's a lot that we do just for the sake of doing it. You know, I shared Nick's feelings that, you know, many people on this panel are some of my very good friends, and we are good friends year round. But when, you know, it's election year season, our job as partisans is to convince the American people that we can't work together, that we have to replace the other person, because that's the only way to get things done. And sometimes part of making a point is to show that there is intransigence, because that is the way we make that appeal to the American public. So it's always important to look and say, when is Congress actually working to what we're supposed to be doing, which is making laws? But when are we also being the partisans that are our basic political nature of what we do, and we're just trying to make a point? Next slide, please. So when is legislative action most likely? You can't really guarantee. There's no crystal ball. Trust me, after 20 years, I can't tell you when things are going to happen. I've had bipartisan bills that have passed the House with 420 votes, languor in the Senate for years because they were too small for the body to pay attention. I've also passed major policy that I thought was going to be controversial, and somehow it's flew below the radar screen. You just never know. But when is it most likely for legislation to actually happen? If Congress is trying to make law and not a point, the first one is a matter of time. We tend to work in odd numbered years because even numbered years, you know, the president can be up for re-election, the entire House of Representatives is up, and 1/3 of the Senate. So it's much harder to do big bipartisan laws in generally speaking, in even numbered years. So odd numbered years, particularly, you know, the first year and the fourth, going into the fifth year of a presidential administration, are when it is most likely. The next one is policy. We typically don't pass laws if we don't agree with the policy. Third, ideology. When have we crossed the ideological red lines that we know exist in both parties? If you have policies that cross those lines, it's much less likely to get a bill, particularly one that can pass both chambers, you know, especially with the numbers that exist in the Senate and the narrow margins in the House at any given time. Partisanship. When is it good politics? There are times where it's good politics to work together. There are times when it's good politics to not work together. And then there are times where it's good policy and the politics say we don't want to be seen, you know, with one another. And when that happens, we pass a law, we all know it's the right policy, and there's no rose garden ceremony. You know, it's signed in a broom closet off the Oval Office because that's what works best for us. And then finally, cross-cutting. When can you get to a good place on most of the above? You know, when is there a vehicle, a deadline that powers the likelihood of action? And when does the time work, the policy work, no ideological concerns, and the partisanship all make sense? Next slide, please. So running through all of that, I will just end with a quick recap of having spent 20 years in the House of Representatives. You know, some general observations about the House. Very different from the Senate. And that is why this idea of the competition for power is so helpful to understand, because you can't understand Congress as a whole. You have to understand the individual sides of the Capitol and how they interact with each other. And again, it's not just a matter of partisanship, it's a matter of their history and their rules and their norms. With the House, it's a majoritarian body. Some would even say authoritarian. It just gets more friendly depending on the political party you're in. It is a body driven by the majority. We are not known as the body of minority rights. In fact, probably the biggest right that the minority has is to know exactly what their schedule looks like. If you're in the minority, as Republicans are, you're told when your day starts. You're told that you will show up for your first vote at 10 a.m. You're going to lose it. Then we're going to make a motion to move to a rule on debate of a bill, and you're going to then vote on that, and you're going to lose. And the amendments you submitted are not going to be made in order, and to the extent that any are, you're going to lose those at this time. And then we're going to move on to the main bill, and then you're going to have any amendments you've offered to that, you'll lose on those too, unless the majority agrees. And then we'll have final passage, and you will lose on that at this time, and you'll be home for dinner. So at least you know your schedule. Unlike the Senate, which is a body of unanimous consent, they have to agree to even meet. Does Monday work for you? No, it's bad for you. Okay, Tuesday's bad for me. Well, we both have that thing on Wednesday. Well, if we can't agree to work this week, let's get together next week and decide when to work. At any point, the Speaker controls everything in the House of Representatives. And that means at any given point, we can be called to vote. The Speaker is the center of power in the House of Representatives. Literally, the Speaker controls space and time. You might think I'm joking, but if you've ever seen a vote held open, you can have a 15-minute vote last 2 hours. As long as the Speaker declares 15 minutes has not elapsed, 15 minutes has not elapsed. The power of the Speaker on the floor controls space and time. The structure of the House, though, is also different for the staffers who work there. The staffs are much smaller, budgets are much smaller, and so those who deal with policy in the House of Representatives usually have to take on roughly a third of the federal government. That means, House legislative assistants have to be multi-experts across various fields. That means that they don't get to go too deep a lot of times, even if their member sits on committees of jurisdiction, because they might be having a meeting on healthcare, but they're watching a floor vote on transportation and keeping track of amendments, and their boss comes in and asks them a question about taxes. They have to be nimble and be able to adjust through multiple subjects. That devolves a lot of power to committee staff in the House, who are able to be more focused and are able to go a little bit deeper and spend time on, not just, healthcare, but individual issues within healthcare, for example. And that's even a lot there. I mean, I was the principal staffer for Medicare. I will never know everything there's need to know about Medicare. I might be able to have had more experience than my LAs, but that doesn't mean that you even get to go the mile deep that you want to as a committee staff. But it also, the structure of the House allows for a lot more power being concentrated in leadership, as well as committee leadership. Whereas the Senate is a body of seniority and you get to be on committees based on seniority. In the House, your placement on committees is dictated by leadership and the current committee chairman and ranking members, which means that there has to be a lot more respect for the role of those two institutions, of the leaders of committees as well as the leaders of the caucuses, which means that there's less opportunity for successful independent actors, shall we say. So whereas in the Senate, you'll see these gangs form, you rarely see that kind of independent action in the House. So I know that was a lot, and with that, I'll turn it over to the next speaker, and thank you for having me, and I look forward to questions.
Thanks for the level setting, JP. Now I'm going to turn it over to Joy.
Joy, you're still muted. If you can make sure.
I can't believe I was the person that was unmuted. I mean, that was muted. I think that's the first time I've done it in a Zoom before, which is a record. Thank you. I was just saying thank you, Nick and JP. This was super, super informative and helpful. And I wanted to mention that I'm going to stay pretty high level and just cover the Senate committees and legislative process. And then Sarah will be able to touch on working with the administration and House committee work. And but I also wanted to just mention that feel free to ask any questions. None of these questions are, no question is too basic. And I know as a young staffer, or even as a more experienced staffer, there were some things that I wish that I could have asked for, or I wish that there was a mentor around that could tell me what to do. And sometimes that wasn't the case. So please feel free to ask anything. I understand that it's anonymous, and we have a great team here that can help answer anything. And then of course, in the future, the Alliance can be super helpful. But with that said, let me dive in. So next slide, please. And we're going to talk just really briefly about the Senate Healthcare Committees. And as many of you may know, the primary committees of healthcare jurisdiction are Senate Finance and the Senate Health Committee. And unlike the House, it's a little bit more straightforward as to what the committee jurisdiction is. The Senate Finance Committee covers all the mandatory programs. So these are programs that are funded in statute and they don't go through the appropriations process for funding. So that includes Medicare, Medicaid, other HHS programs, but CHIP, Social Security, taxes, revenue, all of that goes through the Senate Finance Committee. But as far as healthcare is concerned, generally it's Medicare and Medicaid that you're looking at with the Finance Committee, but there's a lot of healthcare tax issues that also come up as well, as you may know. So HSAs, ACA tax credits, all of that would go through Senate Finance Committee. Then the Senate Health Committee covers public health, health insurance, programmatic authorization. So all of those programs that are funded through appropriations will be authorized and regulated and under the Health Committee jurisdiction. This also includes FDA, CDC, NIH, the Administration on Aging, SAMHSA, Substance Abuse, Mental Health Services, HRSA, the Health Resources Services Administration. All of those are authorized and regulated by the Health Committee. And sometimes it can be a little confusing as far as health insurance and what is the jurisdiction for health versus finance. But the way that I generally think about it is that if it's a commercial insurance, so something that you would get through your employer, most of that is under health jurisdiction. If it's Medicare and Medicaid, it goes to finance. Sometimes there's some overlap and it can get a little confusing, but you can always reach out to the committee and ask for clarity. And then importantly, and this is the same for the House, every single committee has important healthcare jurisdiction. I can't think of a committee that really doesn't. Appropriations is the big one. I know that all of you staffers have probably been through the first earmark process in a while, which is kind of a whirlwind, but you know that there's a lot of healthcare programs there. Indian Affairs oversees the Indian Health Service, which is highly federally regulated and super important. Veterans Affairs, and it includes the Veterans Health Administration. Budget, of course, that's the budget resolution. Commerce has telehealth, among other things. The Aging Committee has oversight and education of healthcare programs. And Armed Services has TRICARE. Senate Foreign Relations has PEPFAR, which is the, I forget exactly what it stands for, but it is the program that provides HIV/AIDS drugs to other countries. So there's a lot of all of this to say, if you are not working for a member who is on either Health or Finance or Energy and Commerce or Ways and Means, there's still a lot of opportunity for whatever committee that your boss sits on to be able to get something through that committee or come up with some good ideas that your boss could champion. And next slide, please. Okay, so just briefly on the legislative process, and then I'm going to talk a little bit more about filling in the blanks here. But let's pretend like you want to introduce a bill and try to get it passed on the infrastructure package. And let's pretend like the infrastructure package is going to include healthcare, just for the purposes of this. So you come up with a policy idea, and maybe it is having to do with a community health, something that would really help your boss's district or state. So your first thing that you would want to do is come up with that idea, maybe work with CRS or Ledge Council to get it fleshed out a little bit more, and then try to figure out which committee of jurisdiction it should go to. Let's say in the Senate, you're not totally sure, and maybe it's a finance or health issue. So you go to both committees, just reach out, email them, ask them about which jurisdiction it should be, or CRS or Ledge Council could also help you with this. And once you figure out where the jurisdiction is, let's say that it's the Health Committee for this purpose, you just ask for a meeting with the Health Committee staff, sit down with them, see what they say, see if it's something that they might be amenable to. Eventually, you need their sign off from the chairman and hopefully the ranking member as well in order to get it through the committee and also get it through in passage into law. So for this bill, let's say that you have sat down with the committee and the committee says a few different things. They could say anything from, oh, this is an old idea. We tried this a few years ago. Could you tweak it a little bit? That happens a lot because there are a lot of ideas out there that have been tried before. Or they could say, we really like it, but the other side of the aisle is never going to agree to it. But if you're able to work it out with them, then we'll be okay. So in that case, you may want to try and rally support. Get some co-sponsors, get some endorsements, some informal sign off from the committee perhaps, or from the chairman or the ranking member. And this was something that I didn't fully understand as a young staffer, but getting an endorsement, if it has to, let's say that this has to do with community health, like I mentioned, you may want to get the Association of Community Health Centers to sign off, get their input, or even ask them what else they need that could go into your policy and into your bill. Then you would want to try and get sign off from the other side of the aisle or from the committee. Whatever the committee staff told you is what you need to do in general, if you want to get it through the committee. So be as deferential as you can while still representing your boss's interest. And then if you can get to a good place, you get your ducks in a row, you've got a list of some strong endorsements from associations. You can even get technical assistance from HHS, and you get your pretty well baked bill pulled together. Then you can probably get committee sign off, and the committee can do a couple of different things. They can take it through regular order and mark it up in a bill, in a big package. Typically what's happening now for regular order is that the committees are coming to agreement ahead of time, and then they'll mark up a big package. Like the health committee is going to do a big pandemic preparedness package that's going to go through in the fall this year. So maybe you could get something into that package, for instance. That would be regular order. As JP mentioned, regular order rarely happens these days, unfortunately. Even when you try for regular order and things do go through the committee markup process, you really do end up at the end of the day needing not only the committee chair and ranking sign off, but you need leadership support. Leadership support is truly everything, because even if it goes through the committees, if one of the leaders in the House or Senate are opposed to your idea, it's not going to happen. So you really do need to try and, once you get the committee support, to try and read in leadership. Sit down with staff from both sides of the aisle and see if you can work out any differences in advance. If you're able to get leadership support, once you get to that place, there's a few things that you can do. You can try to get it into a broader package like infrastructure. So as I mentioned, let's pretend that infrastructure is going to be a really gigantic package that includes healthcare as well. You can get that sign off from leadership and they'll just kind of tuck it into the package once you have all of these other steps done. Another thing that you can do, and I should mention that you can do this without leadership support as well in the Senate. One of the most liberating things about being both coming to the Senate after being in the House for a little bit was that the Senate does not have a rules committee. So even if you're just working for a member who is not on a committee, even if you haven't gotten committee sign off, or they just haven't gotten to your bill yet, or leadership just hasn't gotten back to you because they're too busy, or there's an issue with your bill, you can offer your bill as an amendment onto the budget resolution, which would be in Vote-A-Rama. Happy to answer questions about that another time. That would be during budget reconciliation or budget resolution. Or if there's let's say the infrastructure package goes onto the floor and you weren't able to get into the underlying bill, your boss could just introduce an amendment and then actually go to the floor and insist that it be taken up. And at that point, you can go onto the floor and negotiate with the committee leadership, Senate leadership, the other side of the aisle in person, and work out your differences on the floor and get it into the bill. Then let's say that that happens, you're successful, you get it into the infrastructure bill, you get Senate passage, high fives all around, this is a huge thing. Then you're not necessarily totally done yet because the differences have to be worked out with the House. So this is when you really do need leadership support, because those conferencing, the conferencing and the reconciliation of the two differences between the House and Senate, that in the past few years has really been done primarily by leadership and committee staff, more leadership even than committee staff in a lot of cases. So at that point, you would need to, if you didn't already have leadership support, you would need to have your boss calling Schumer, your boss calling McConnell, Pelosi, making sure that everything is putting on the pressure, getting other co-sponsors to call, getting all of the endorsements that you got really in step 2. That is where you would have them call and weigh in and make sure that it's one of those pieces that remains in the bill. And then once you get past all of that, then you would actually have something in law. And it's a great feeling to actually pass something that you've worked really hard on, especially when you know that it's going to do something good for your boss's state or district. And it's something that I know everybody, all the other panelists can talk more about, but that gives you kind of a high level flavor of the process and what it looks like, a little bit more behind the scenes. And with that, I am happy to answer questions. Like I said, no question is too basic, and we want this to be interactive. So once Sarah speaks, please feel free to weigh in and ask more.
Thanks, Joy. We'll turn it over to Sarah.
Hi, everyone. I don't know why I look like I'm in a dark tunnel. I'm in the brightest room possible, but here I am. Thank you for having me. Thanks to the Alliance. You've all done this before, I'm sure. I have to say a disclaimer since I'm still on the Hill. I speak for myself. I don't speak for the chairman, for the Ways and Means Committee, for Democrats everywhere, and the like. And I just want to echo what Nick and JP were saying about the Alliance and using them as a staffer. If you want to learn, the Alliance will teach you, and not only subject matter, but also how and where to ask the right questions and get the answers. So if you're starting out in your career on the Hill, I would recommend going to as many Alliance events as possible. You will learn about interesting topics and topics of the day. Even if you're not working on those specific topics right now, you may be working on them in the future. And I'm going to be talking about working with administration and other congressional support agencies to get work done and get policies over the line. And I'm sure you've all heard throughout either now currently in your roles or in your college careers, the famous Otto von Bismarck quote that says, if you like laws and sausages, you should never watch either being made. But I think this New Yorker cartoon is more apt. It's not as interesting as people say. But next slide. So I'll start off with talking about the administration, and before I get into how we work with the administration, I do want to echo a little bit of what Joy had said. If you have an issue that or a question about an issue, you should absolutely feel free and seek out the committee of jurisdiction and the committee staffers who have expertise on the issue. They may be able to provide you with some quicker feedback than you would be able to get from, another agency or the administration or others. And also you can make sure to let them know that what your boss is concerned about or what you're thinking. So I'll start talking about how we work with the administration all the time. And as Nick said earlier, we work with them no matter which party you are in Congress and which party is in the White House. We are constantly working with the administration. One of the main conversations we have with the administration is on as a committee and in creating in the legislative process is technical assistance. And technical assistance is like okay, I'm working on a policy or developing it. You want to make sure that the administration can actually implement the policy that you're thinking of. So you have an idea, you have a policy, but is this actually something the administration can do? So it's not policy, it's not like qualitative in nature. They're not gonna, you go reach out to the agency, say, have this policy, what do you think? They're not gonna say like, this policy is good or this policy is bad. They're gonna answer two really main questions. One, is your policy operationally feasible? And like, if it is operationalized, does it actually do, will it achieve the goals you want? Does it actually do what you want it to do? So TA is like a really important part of the legislative process, because we want to pass policies into law that actually do what we want it to do. And you can, for healthcare related TA, we often reach out to HHS, and within HHS, depending on the policy, you can work with CMS, Center for Medicare and Medicaid Services, the FDA, the CDC, HRSA, and the like, but also working with the Department of Labor and the Department of Treasury for private market insurance. Then we talk to the administration all the time on implementation issues. Like, we pass a law and your boss this may be a policy their boss worked on, or your boss has constituents that really care about this issue. You can make recommendations to the administration on how to implement the law. You can make recommendations on how they're implementing the law. Maybe you have suggestions. Maybe you'd like them to do something differently. All these things you can do and work with the administration and talk to them. For example, Congress recently passed a whole bunch of stuff in last year related to the coronavirus, and a lot of feedback. We got a lot of feedback from from our members, from constituencies, from stakeholders on how to implement different pieces. And Nick will smile about this one because I know it's something he worked on intimately at HHS, but we had a lot of feedback from stakeholders on how to implement the Provider Relief Fund. So this was a fund to give out money for providers who work on Medicare and Medicaid, and a lot of providers said, oh wait, I did not get enough money. Something happened. They're distributing in a way that hurts my type of provider. They're distributing in a way that is didn't give me the amount that I think I should have gotten. Those are kinds of conversations that you can then have with administration. Hey, I think you should improve upon this. Hey, you may have missed upon this, or here are some suggestions I can work on that. Additionally, in healthcare, particularly with the programs that CMS runs, there's annual rulemaking. There are rules that the administration puts out and says, hey, here's how we're governing Medicare, the marketplaces, this year. And they change every year. And there's an opportunity to provide input on these rules, and stakeholders will come and ask you to comment on them. Your boss may have an issue that he or she cares about. They want the administration to either implement the rules in one way or another. You can reach out to the administration relating to this rulemaking process. There are programmatic questions like, what is the program? What do you do with it? Like, I don't know anything about this program. It sounds cool. Tell me about it. Budget questions. How much are you spending on specific issues or programs? Constituent issues. Your constituent is working with an agency and is having a problem or has some questions. You can reach out to the agency to try to resolve those. Again, we're talking about recommendations about specific policies under the authorities that the administration has. You have these authorities, we think you should do X, Y, or Z. You're using the authority in one way, we wish you would do it a different way. You can make those. And then the constitutionally required oversight is also another way to work with administration. We are overseeing the work that you're doing, and we want to make sure that you're doing it in a way that Congress intended. And all of these kinds of working with administration, there's several different ways you can do it. You can do it in a more informal contact, staff level emails, calls, requests for information, that kind of thing, or a more formal level of conversation with administration, a member level call to a senior official, or formal letters to the administrator, the president, the Office of Management and Budget. But the administration they are implementing the laws that Congress has passed, and they are a resource to either influence the implementation of the policy, or when you have questions about that implementation. Next slide, please. And, I'll just quickly go over the legislative process in the House. And, you probably all know this is, but, you draft a bill, you work with other committees, staffers, other offices, caucuses. In healthcare, we remarkably work on a bipartisan basis very, very, very often. I know in the news, it specifically looks like healthcare is a lightning rod issue, but most of the bills that we get are bipartisan issues, and you can find ways to find agreement on areas. And whereas there will always be areas where the two parties cannot come together, there are very many areas where the parties can come together. You look for stakeholder input, and this can be, again, formal. You can committees can hold hearings. There could be roundtables, and then informal meetings and with constituents and the like. Always part of the legislative process is this technical assistance, again, because you want the bill to do what you want it to do. And then one of the big parts of the process is making sure you have a score from either the Congressional Budget Office for spending programs or the Joint Committee on Taxation for revenue raisers, anything to do with tax. Next slide, please. One of the biggest pieces of the puzzle, and as someone I recommend you work with as often as you can relating to policies that you're drafting for your boss. Ledge Council, they're a bunch of magicians. They really do help you trying to think through the policy, and you can give them the parameters that you want, and they'll help you think through how to develop that into actual legislative text. I think that this scene from Apollo 13 is pretty apt. We give them impossible policy goals, and they think about how to make it into actual policies that become law. And what I would really recommend people do, even if it's hard to try to figure out, particularly in the beginning of your career, how to use the current statute to amend it to create law. Just tell Ledge Council like as much detail as possible about your policy goal, and they can help you think through what kinds of words will help you get there. Next slide, please. And lastly, I'll talk about the role of our congressional support agencies, which are the governmental folks who help you think through policy in the healthcare sphere. I'm sure you all know well Congressional Resource Service. They have so many tools at your disposal. They can write memos, they can ask any question about any of the programs. Please use them, they're wonderful. And then the Government Accountability Office, I don't know if you use them all that often, but you should. If you don't, they're constantly churning out useful reports that help Congress oversee the implementation of programs. They're particularly handy in their succinct and clear discussions of issues that help you quickly learn an issue. They use lots of really fun graphics. And they also make recommendations on how to improve policy. So if you're looking for a policy, you're looking for something that your boss cares about an issue and you're looking for a policy to develop, that's an area to go to. You can see if GAO has made any recommendations. I didn't put this on here because it's not necessarily a Congressional Law Support Agency, but the same goes for the Office of Inspector General at HHS. They also put out recommendations and put out reports that succinctly describe an issue. Additionally, there's the Medicare Payment Advisory Commission, also known fondly as MedPAC. They are a one-stop shop on anything Medicare. Go to their website, look at their payment basics. They tell you they explain to you in like one page all of the different types of Medicare payment systems. They're on their website. You're like, oh, someone comes and talks to you about the physician fee schedule. You're like, oh my goodness, what in the world? That's a word soup. What does that mean? Go to the MedPAC website. They will explain what that is and how in a very easy to read terms. You can also reach out to them. They're happy to explain anything. They put out 2 sets of recommendations to Congress each year, one in March and one in June, on ways to improve the Medicare program. It's also a good place to look for to understand the programs better and to look for some ideas. MACPAC is the similar agency for Medicaid and CHIP. And then lastly, CBO. CBO, as you know, it is required to have a CBO score for spending bills before they pass the floor. CBO helps you think through scores, and they're really important particularly for Medicare, particularly for healthcare. Just as a reminder, Medicare and Medicaid spend about over $1 trillion per year, so healthcare bills can get expensive pretty quickly. And so CBO helps you think through budget ramifications. Additionally, the Joint Committee on Taxation for the tax side. CBO also puts out policy documents that help Congress think through budget ramifications of policy. So I encourage you to use them for that as well. But they are, you hear of CBO a lot because there could be really great ideas on how to improve a program, but they could be really expensive. And CBO will say, well, your idea costs like $10 billion. You have to think about, oh no, how do I have $10 billion of equal offsets, or how do I pare down the policy so it's not as expensive, so I don't need to find $10 billion. And so that is constantly a challenge that Congress is working on. Okay, this costs X amount of money. How do I think through either offsetting that policy or reducing that score? And with that, I look forward to answering any questions.